Up to 60% of ER visits are a total waste. And for something like a thermal burn, you may need an ER visit, you may not. So in this video, I'm going to tell you what to do when your kid has a thermal burn, whether it's a true emergency or not. The absolute worst case scenario with a burn involves the airway or massive skin damage. If a child was exposed to smoke, flames, or heavy fumes and shows any difficulty breathing, or if you see soot around their nose and mouth, that's a life-threatening emergency. The danger here is an inhalation injury, where the airway can swell shut rapidly. Another immediate red flag is if the child becomes confused, unusually drowsy or sleepy, or having a difficult time waking up after being near a fire, which points to carbon monoxide poisoning. Finally, if a burn covers a large portion of the body, roughly equal to 10 or more of the child's handprints, or if the skin looks charred, white, leathery, the body can quickly go into shock from fluid loss. None of these are wait-and-see situations. They require calling 911 immediately. While waiting for emergency services, the only first aid should be moving the child to fresh air and gently applying cool, wet cloths to the burned skin. So slightly down the scale are burns that still require a trip to the emergency or an urgent care center right away, even if they aren't immediately life-threatening. So what makes this category different is the presence of blistering over a significant area, burns affecting critical parts of the body, or specific mechanisms of injury. So if blisters cover an area larger than 2 of the child's handprints, or if a single blister is larger than 2 inches, it needs professional care to manage the tissue and prevent severe infection. If blisters are on highly sensitive or functional areas like the face, neck, hands, feet, belong in the ER or urgent care. A burn on the hand can cause tissue tightening that restricts movement, while facial burns carry cosmetic and structural risks, and you also need an immediate evaluation if a blistering burn completely circles an arm or a leg, as the swelling can cut off flow to the limb. Burns caused by explosions, gunpowder, or intensely hot chemical substances also fit into this urgent category. Other situations do not necessitate the emergency room but still require professional evaluation within a few hours or a single day. The concern here is usually infection or inadequate pain control. So if a child has a burn and experiences excruciating pain that does not improve even 2 hours after giving them an appropriate dose of pain medicine, a doctor needs to evaluate them. Any spreading redness, red streaks that are moving away from the burn, or pus are obvious signs of infection. And if these symptoms are accompanied by a fever, your kid should be seen within a few hours. If there is spreading redness or pus, but no fever, a same-day call to your pediatrician is the right move. If a blister has ruptured and the dead skin needs to be trimmed, a doctor should examine it within 24 hours and protect against infection. So many minor burns can be safely managed at home without any medical intervention. So these are the typical first-degree burns where the skin is pink, it's intact, it's together, and painful, similar to a mild sunburn or a very small isolated blister under an inch in size that are not on the face, hand, or genitals. So for home care, immediately cool the area by placing it under cool running tap water for 10 to 15 minutes, and do not use ice because extreme cold can damage the tissue further. Never apply butter or oil or home remedies to a burn because they trap the heat inside the skin and can introduce bacteria. Clean the area gently with mild soap and water, and if a blister is intact, leave it alone. It is a sterile, natural Band-Aid, protecting the raw skin underneath. And if a small blister breaks on its own, wash it gently and apply a plain petroleum jelly or an over-the-counter antibiotic ointment. Then cover it loosely with a non-stick sterile bandage. I say non-stick because it can stick to the wound, and it can hurt when you're trying to change the bandage, so non-stick. Keep a close eye on the healing process. If the burn is not completely healed after 10 days, or if you're dealing with a sticky substance like hot plastic or tar that you cannot safely remove after a couple of days, that's a reason to schedule a regular visit with a healthcare provider. And to summarize, thermal burns range from minor household mishaps and critical emergencies, so prioritizing the airway and overall responsiveness first. Any breathing trouble or altered mental state, that means calling 911. And then large burns, deep charring, and blisters on the face or hands require immediate emergency room care. And then spreading redness, uncontrolled pain means a same-day call to the doc. For everything else, small, superficial redness or tiny blisters, keep the area cool, keep it clean, leave the blisters intact, and let the body heal naturally. Click like and subscribe for more information on how to stay out of the ER.